Hello, Dr. Melanie McLaren here. I'm here to talk about one of my favorite things I do, functional lab interpretation. And today I'll focus on CBC, complete blood count, and comprehensive metabolic panel, or CMP. These are labs that most people get done every year. I mean, we have a primary care doctor, and it can really tell us a lot about what's going on in the body. My next webinar that I'll do or video on this topic will be on your thyroid labs and hormone labs. So a little bit about me. I'm the owner of Dragonfly 360 Wellness. I have a bachelor's in engineering, and I had a lot of chronic health issues, and I went to a naturopathic doctor, and I felt so strongly about my journey that I went back to school and got my doctorate in naturopathy. I'm nationally board certified. I'm also certified in AET practitioner. It's a gentle allergy treatment, non invasive, also can be used to treat food sensitivities. And I would say the main reason people come to see me, they have a chronic health issue and they want to figure out what's really causing that issue, the root cause. So the agenda will be to talk a little bit about what is functional lab interpretation, and then I'll give a few examples of patterns I see in CBCs and then the CMP patterns. And at the end, I'll talk about a couple of special offers on discount on supplements and then an offer for an interpretation of your existing CBC and CMP labs. So, did you know that the laboratory ranges are based on population? So, what that means is if we have a sick population, this is providing a normal range that is not a healthy range. So, by looking at the patterns of these lab markers that are on the high end and low end of these ranges, we're identifying potential issues and being preventative. So, in other words, we want the range to be tighter. So, the two scenarios I see in patients, they come in, they've been told their labs are normal or they are normal in the range on the labs, but they don't feel normal. And the other scenario could be they're told their labs are normal, but they have some markers that are out of range that are concerning. And so they just want to understand that more. So, talk about a few of the patterns I might see on a CBC. This one with parasites, we would see these white blood cells, particular white blood cells, be elevated, eosinophils and monocytes. And the white blood cell count might be low or like on the low end of the range. Neutrophils also might be low, or just again, maybe not below range, but on that low end of the range. And I just like to comment on parasites. Sometimes people think they're going to have digestive symptoms, but many times they don't. It can be other things going on. Many times a patient will be asking hey, why is my MCHC and MCH, which has to do with our hemoglobin, elevated, as well as the MCV? This can be due to a deficiency in B12 or folate. It also could show that they need methylation support, which is a pathway that helps us detox and helps our hormones, cardiovascular. So there could be some support there, which a lot of that has to do with taking methylfolate and B12 as well as some other nutrients. Could also be a vitamin C deficiency. These values, if they're high, and then on the CMP, which we'll talk about in a minute, if the blood urea nitrogen, the BUN, is increased, it might also be due to low stomach acid. A pattern where we might be dealing more with bacteria overgrowth, such as SIBO, which is small intestinal bacteria overgrowth, would be white blood cells again on the low end, but your neutrophils might be slightly elevated, lymphocytes low or low end of range, and again, the monocytes and eosinophils elevated. In this case, too, we could look at symptoms, with SIBO. If you have these lab markers off and then you also have digestive bloating, which is worse in the evening, maybe constipation, diarrhea, bloating with carbohydrates, and sometimes probiotics and B vitamins may make those symptoms worse. And some other symptoms you might see with SIBO as well that are not related to digestion. On a comprehensive metabolic panel, which is your kidney liver function, there's some markers that might indicate digestive dysfunction. Albumin, which is a blood protein, could be low. Blood urea nitrogen, which I mentioned before, it could be slightly elevated or on the high end. If someone is eating protein, enough protein, and their total protein is low, that could be related to this too. Globulin, which is another blood protein, could also be low. In the case where it's related particularly to low stomach acid versus maybe your pancreatic enzymes, you would also see minerals be low, such as calcium, chloride, and phosphorus. For low functioning adrenals on a CMP, we could see sodium be low, but potassium might be elevated, chloride low, and your glucose might also be on the low end of the range. For someone that's got a little bit of overstimulation with adrenals, you might see the opposite patterns. So I mentioned the offer. If you have existing CBC labs, CMP labs, and you would like me to functionally interpret those, through July 31st, we're offering $80 for me to do that. And that includes a 20-minute consult with me and an email summary of that interpretation with some suggested supplements. And there's a QR link right here where you can book that functional lab interpretation, and then we'll get in contact with you to get the labs. Or you can also reach out to us to schedule as well. And I just listed a few of my main areas of focus here. I do a lot with digestive issues, allergies, food sensitivities, sleep, mood issues, help people with weight loss. I do also deal with hormonal imbalances. It could be thyroid, sex hormones, adrenals. And I also have a supervising physician that's a DO, so I can do hormone replacement therapy. I do bioidentical as well as thyroid replacement therapy if needed. Also deal a lot with toxic loads such as environmental toxins and molds. I offer both in-office and virtual consults. And if you'd like to see some of the recommendations for the supplements, for the patterns that I talked about today, you might have your labs and see those. You can go to our full script dispensary store. There's the QR code for that. And if you don't already have a login, just create a free login. And then under our community plans, you'll see these titles: the digestive insufficiency, parasite cleanse, SIBO, adrenal support, and the methylation support. You will get 10% off automatically ordering through our store, and it's free standard shipping over $50. If you have any problems finding those, let us know. Appreciate you watching today. We are located in Indianapolis, but as I mentioned, I do virtual consults all over the country. Here's our phone number, email, our website is dragonfly360.net. And if you want to follow me on Instagram, it's at Dr._Melanie. And any questions, please reach out.